Hey everyone, welcome back to SG Dr. Wellness. Today, we are delving into the topic that's been making headlines lately, rhabdomyolysis, when too much exercise can actually be unsafe. There are occasions where pushing too hard has negative consequences to the body. Before we begin, give us a huge muscle up by hitting the subscribe and notification buttons now. So, what exactly is rhabdomyolysis? It's a syndrome where severely overworked or injured muscle cells starts breaking down, releasing byproducts into the mainstream, including a protein called myoglobin. If myoglobin floods your system, your kidneys can't flush it out fast enough, potentially leading to acute renal failure and, in some cases, even death. In Singapore, there's been a concerning rise in rhabdomyolysis cases, particularly due to overexercising. According to an April 2021 report by CNA, Tock Seng Hospital's consultant mentioned seeing about 5 overexertion cases in just 1 month. Now, let's talk about the contributing factors of rhabdomyolysis. They include training without supervision, especially for beginners, exercising in hot and humid conditions without adequate hydration, and not knowing your personal limits and overexerting yourself. It's easy to get carried away, whether it's in a high-energy spinning studio, a CrossFit gym with enthusiastic cheering crowd, or a traditional gym where you're chasing your New Year's resolution. But how do you know if you might be at risk? Well, here are some symptoms to look out for. Number 1 will be persistent muscle pains and cramps that might be more severe than expected. Dark-colored urine resembling tea. Increased thirst but reduced urine output. Confusion and nausea. However, symptoms alone can't confirm rhabdomyolysis. Conditions like dehydration and heat cramps can actually mimic these symptoms as well. The only way to be sure is through blood tests, specifically measuring the muscle protein creatine kinase. If you suspect rhabdomyolysis, please don't wait. Head to the emergency room immediately because early treatment is crucial in preventing kidney damage. Doctors will likely prescribe aggressive hydrations such as IV drip to flush out the toxins. So how can you protect yourself from overexertion and also its nasty side effects? First and foremost, please don't rush and push yourself too aggressively, especially if you're just starting out. Remember, health is a marathon and not a sprint. Stay hydrated during exercise, especially when it's hot and humid outside. Heat can accelerate muscle breakdown, and without enough fluids, your kidneys can't do their job. Alright, that's a wrap to our guide to rhabdomyolysis and staying safe during your workouts. Thanks for tuning in, and remember, your well-being should always be of top priority. Take care of yourself, exercise safely, and we'll see you in the next video. Stay safe and stay active.